Hello everyone, this is Hira Hassan. I would like to discuss today about my horrible experience and very sad experience, and it's subtopic pregnancy, which I'm just suffering from the treatment of that. I'm still in a hospital right now, and I just want to discuss about my symptoms, my diagnose, and everything about this topic pregnancy. So if you're watching this video, it means you have suspect that you have a topic, might you already diagnose it, and might this video will help you. I have a son. He's like 18 months old. I'm trying to conceive for him. Just we thought to bring his best friend or his companion. I tried, and I was breastfeeding him first, and first month was June when I tried to conceive according to my ovulation and everything I record, and I didn't conceive. According to the doctor, it was like because I was breastfeeding him, this could be a reason. So he was not totally on my breastfeeding. He was like solid food and formula milk also, but sometimes I was breastfeeding him as well. So in month of July, starting of the July, I just quit completely the breastfeeding, and according to my ovulation, and we just did our part on that ovulation date. My ovulation day was 6th and 7th of July, and exactly on 7th of July I start bleeding, like brown, dark, and like old blood bleeding. It was not like heavy like normal periods. It was just like spotting, more than spotting, which is can be brownish. It started exactly on my fertile day, which was very fertile day, was 7th of July. I thought it was the ovulation bleeding or is implantation bleeding, something like that, and I just take it easy. After that, I waited for a few days, and my bleeding and spotting continued with no pain, no cramping, nothing. When my periods came, my periods, according to the cycle, my periods were supposed to be this 20th of July, and near to this 20th July, like 8, 17 or 18, I start feeling like small cramping, heavy feeling, like periods, same periods feeling, and my spotting did not increase. I didn't get my periods. 18th of July, I have checked my pregnancy test, and it was very faint line on that. So I thought it's like because of the early pregnancy, that's the reason it is very faint, very light, and I was really happy, like, because in first month in June I could not conceive. So in July, next month, 2020 July, so 18 July 2020, I have checked my pregnancy test, and it was positive. I was very happy. I told my husband, he was also happy. We went for a treat and we had a donuts. We were really happy that we are gonna have again one small angel. Then I talked to my doctor that I am really, because in somewhere in my heart, somewhere in my mind, I was suspecting that it is not normal, because in my first baby nothing happened like that. Nothing happened like that. So I just talked to my doctor. She's really, really nice, really experienced, very good doctor in UAE. I found her very helpful. So she told me, don't worry, let's grow this baby, because I cannot see anything on the ultrasound right now, as it is a very early stage. And after that, my 21st 20 when I missed my period, 21st of July, I again did the pregnancy test at home only, and again it was normal, it was positive, but it was again a very faint line. It's not supposed to be like that. And I just put that stripe in my on my table, and I just leave it. I left that. After 10 minutes, when I see it again, it was bit, you know dark, because my HCG level was really low that time. HCG is which is the pregnancy hormone. um, I just told this whole story. I sent the picture to my doctor that this is happening. She said you have to do that CG level test because I am expecting there is something going on which is not normal. And I said okay. I did my CG test, and it was 158 in my HCG level when I did the first HCG test. After, it's supposed to be like again repeat it after 48 hours. It's supposed to be double. The number of HCG level should be double. My HCG level was not double. It was only 199. So doctor was like now 80% she was sure that there is a ectopic pregnancy. And I never heard about this thing, what is ectopic pregnancy. I start searching. Doctor also described me what is ectopic pregnancy, how what will happen in that and everything. And she told me let's just do one more test, maybe it will double, and we will do one scan also. So we did it last yesterday, which was like 25th of July. I came here I came here to just give my blood sample and to do the ultrasound test. And when they take my blood, first they took my blood and then they took me to the radiation department where they did my ultrasound test, scanning. And the ultrasound, they have found that there is nothing in the uterus, and there is a baby on my left tube. There is not a baby, you can call it, you can say it's like a sac. It's a sac which is growing inside my left tube. The doctor was they did not allow me to go back to home. And I was like, I just came here to just give the sample. My son was at home, I was alone, my husband was at office. And I said okay. They told me to just wait for the blood test. Just wait for the blood test, let's see what's your SHG level. I said okay. I waited for 2 hours in a hospital itself, and they continuously nurses was coming to me. They're asking me, did you have any pain, anything? I said I'm normal, I don't have any pain. Yes, I'm having bleeding, which is like from 7th of July I'm having continuously. So that's the only thing I'm having right now. Then my report came and my HCG level was low. It was not previously it was 158 in the start, I think, and then it was 199, and the last time it was 178. It was low than 199. So it was decreasing, but not decreasing that much. But it should be double, which was not happening at all. So they said we have to keep it, we have to do something, we have to treat this ectopic pregnancy. It is 100% ectopic pregnancy, and we have to treat it, and you cannot go back home. They admit me, and they did my some blood test. They want to check my liver or something, and clot test. The 4 samples they have took from my side, from my for my blood, to check everything is fine. So they can they just decided to give me the medical treatment. There are 2 treatments for this ectopic pregnancy, which is first is like surgery, in which surgery you will lose your tube and your ovary one side, but other side, which is like even either left or right, you have ovary and you have the tube, you can get pregnant again, of course. But I really don't want to lose my ovary or tube. I was so scared. So doctor told me that don't worry, we will treat you medically. It will be the 2 shots of I don't remember the name of the injections. 2 injections we will give you on your bum and then it will stop the growth of the baby. And yes, last night they gave me 2 shots. Right now I didn't feel any pain. It's just small discomfort and no pain at all. They told me that if you feel anything like not normal, just report us. So if anything like pain or any heavy bleeding, we might take you to the surgery, because this is really life threatening. This is not something you can take it easy. This is really, really hard to hard to for me. It was like I'm losing my baby from myself. I'm allowing them to do something, so which is making my baby to, you know to die. I was just feeling like that then, but doctor told me that there's no heartbeat. There is no heartbeat. There is just a formation of a clots, and this is for you a really life-threatening things. You have your son. You cannot do this thing with you. So I just had it, and doctor is keeping me in hospital for 24 hours, just the for the observation. And let's see. I will post my another video telling you what is how I'm recovering, what and all these things. So anyone who is having, I didn't have any pain in my whole journey of this ectopic pregnancy. Not that much pain which I was like, I say I would die, or like I feel like small cramping which is actually normal in early pregnancy. But this bleeding thing which was started so early was is really suspectable. If you have something like that, please contact to your doctor and do very early the HCG check, the blood test, so to just get to know your your HCG level is doubling or no. And if it's doubling, it's very, very good, and if not, then doctor will advise very well to you. Because I'm very thankful to my God that I suspect I just found it out in very early stage. If not, then I would go to, for sure they will put me for the surgery, which I really, really don't want. I'm so scared of that also. So if you are watching my video, of course you are having some problem like that, or maybe someone, your friends and family having this, just advise them to consult the doctor as soon as possible and do the blood test and check the HCG level as soon as possible. This is really, really important. And yes, inshallah, I will put my again my video to tell you guys what is what's my condition and what's everything. And as for now, thank you so much for watching. Bye bye.